Blood pressure regulated by two groups of systems. It's neural regulation and hormonal regulation. Neural regulation includes two groups of receptors, it's baroreceptors and chemoreceptors. Hormonal regulation acts primarily through renin-angiotensin-aldosterone system and also by secretion of antidiuretic hormone, so-called vasopressin. The main difference between neural and hormonal regulation is speed of response. Neural regulation sends and reacts very quickly, so it's fast response mechanisms that act through autonomic nervous system activity. Recall that autonomic nervous system consists of sympathetic and parasympathetic nervous system. So by increase or decrease in sympathetic nervous system or parasympathetic nervous system activity, neural regulation keeps blood pressure constant. Hormonal regulation acts more slowly, it sends and tries to correct, primarily by increase in blood volume. Just to compare the speed of a response, for neural regulation to sense and to provide a response by activation of sympathetic nervous system, for example, takes seconds, but for hormonal regulation it takes much more time. For example, activation of renin-angiotensin-aldosterone system causes increase in aldosterone level, but because action of aldosterone requires new protein synthesis in the kidney, to be more precise, aldosterone-induced synthesis of sodium-potassium ATE phase is a protein that serves as pump that increases sodium absorption, and for aldosterone to synthesize this protein requires hours to days. That's why hormonal regulation acts slowly, so neural and hormonal regulations have a dramatic difference in speed of a response. Now about neural regulation. Neural regulatory mechanisms have the common structural pattern. They have detector, basically it's a receptor that determines what's going on with blood pressure, blood volume, or gas composition of the blood. They have afferent neurons that carry information from receptor to brainstem, where this information received initially by nucleus rectus solitarius that after regulate activity of coordinating centers. And after, afferent neural pathways carry the signal to a target organ. These afferent pathways can be sympathetic or parasympathetic, and the type of afferent neurons determines the response. For example, if it's sympathetic nervous system afferent neurons, it will stimulate, for example, sinoatrial node, and this will result in an increase in heart rate. But if it's parasympathetic nervous system vagal afferent neurons, it will inhibit sinoatrial node, and this results in decrease in heart rate. The effectors, basically its target organs, are primarily blood vessels and heart. So detectors can be baro or chemoreceptors, baroreceptors can be high pressure and low pressure baroreceptors, chemoreceptors can be central or peripheral chemoreceptors. To explain the general principle how these receptors regulate blood pressure, let's first of all discuss the most well-known high pressure baroreceptors. First of all, it's mechanoreceptors. They are localized in carotid sinus and aortic arch because it's a high pressure sites within cardiovascular system, and their function is to regulate arterial pressure. They sense pressure, but which is even more important, they sense the rate of change of pressure, and they have the highest sensitivity not even to the pressure itself, but to rate of change of pressure, and they act through increase or decrease in firing rate. So it's common carotid artery, it's external and internal carotid arteries, and there are baroreceptors. And its heart, it's aorta with aortic arch, and there are baroreceptors. Such baroreceptors localization is caused by two reasons. First of all, it's high pressure sites within cardiovascular system, and also they determine the most important characteristics of blood flow. In aortic arch, they determine the volume of left ventricle ejection, basically it's a stroke volume, and in carotid sinus, they sense the volume of blood that is going to the brain. It's a mechanoreceptors, basically they sense the static pressure on them, and under this pressure they stretch. So it's blood vessel, and through this blood vessel flowing some volume of blood. This volume of blood causes static pressure on blood vessel wall that is sensed by baroreceptors. And in the second moment, the volume of blood increase, thereby P-static increase, and under this increased P-static, baroreceptors stretch, and they sense this in a biphasic fashion. To explain this, let's suppose that initially blood pressure was 90, then become 120 and then 150. So in the first graph it's pressure, it's time, and in the second graph it's receptor potentials, basically it's what receptor sense, and it's time. And initially blood pressure is 90 and there is initial receptor potential. Then blood pressure rapidly increase and become 120. The baroreceptor sense this, initially as rapid large depolarization, that after becomes steady modest depolarization. The large depolarization called dynamic component because it's increase and decrease very rapidly, and steady depolarization called static component because it's maintained on the same level. And then when blood pressure increase further to 150, baroreceptors again rapidly depolarize, and then depolarization decrease to a modest steady level. It's important because overall the function of baroreceptors is to sense and transmit signal to brainstem, and baroreceptors transmit signals by firing rate. Firing rate basically the frequency of signals. The higher is blood pressure, the more baroreceptors stretch, the higher is the firing rate, so the higher is the frequency of signals they send. And firing rate is directly proportional to receptors' potential. That's why it's important to know that baroreceptors sense in biphasic fashion. So when blood pressure was 90, the firing rate was relatively slow. And when blood pressure became 120, initially on a stage of a large depolarization there is a rapid increase in firing rate, then firing rate decreased to a steady level, and then when blood pressure increased to 150, there is again rapid increase in firing rate that after decreased to a steady level. So it's the general principle how baroreceptors transmit signal about current state of blood pressure. And when baroreceptors sense information about arterial pressure, by afferent pathways this information is transmitted to brainstem. Let's illustrate it. From carotid sinus, initially signal is going by carotid sinus nerve that after joins glossopharyngeal nerve, which is the ninth pair of cranial nerves, and by glossopharyngeal nerve signal is coming to brainstem. And from aortic arch signal is transmitted by nervus vagus. To be more precise, by sensory fibers in depressor branch of nervus vagus. So from aortic arch in nervus vagus signal is coming to brainstem. In brainstem, initially signal is coming to nucleus tractus solitarius that regulate activity of cardiovascular coordinating centers. It's vasoconstrictor center, cardiac accelerator center, and cardiac decelerator center. Vasoconstrictor and cardiac accelerator centers provide sympathetic nervous system response. Cardiac decelerator center provides parasympathetic nervous system response. From vasoconstrictor center, afferent neurons of sympathetic nervous system initially synapse in spinal cord, and then preganglionic sympathetic nervous system fibers are going to sympathetic ganglia, and from sympathetic ganglia postganglionic fibers are going to target organs, providing sympathetic nervous system response. In case of vasoconstrictor center, it provides vasoconstriction in arterioles, veins, and venules. Cardiac accelerator center, because it provides sympathetic nervous system response, have the same pathway. The signal also by afferent neurons go into spinal cord and then to sympathetic ganglia, and from sympathetic ganglia postganglionic neurons go into target organs. So it's standard sympathetic nervous system innervation. But in this case, it's sinoatrial node in the heart. It stimulates sinoatrial node, thereby increasing heart rate. Also, it increases conduction in IV node and stimulates cardiac contractility. Cardiac decelerator center is a part of parasympathetic nervous system, and afferent neurons through nervus vagus are going to sinoatrial node in the heart. It inhibits sinoatrial node, thereby decreasing heart rate. So vasoconstrictor center causes vasoconstriction of arterioles, veins, and venules. Cardiac accelerator center stimulates sinoatrial node and causes increase in heart rate. Also, it causes increase in IV node conduction and increase in cardiac contractility. And cardiac decelerator center decrease heart rate. So basically the logic of baroreceptors activity is that they send signal about current state of blood pressure to nucleus tractus solitarius that further regulate response through cardiovascular coordinating centers. Now, for example, blood pressure decrease. It stimulates cardiovascular centers and they provide sympathetic nervous system response. It stimulates vasoconstrictor center. This causes vasoconstriction of arterioles, venules, and veins. Constriction of arterioles causes increase in systemic vascular resistance. And by constriction of venules and veins, it decreases unstressed volume. By unstressed volume, we understand blood volume that is deposited in veins. And by veins vasoconstriction, their compliance decreases, so some volume of blood from veins is going to general active circulation. It causes increase in amount of blood that is coming to the heart. It's called increase in systemic venous return, and this causes increase in stroke volume. Recall that cardiac output is equal to stroke volume on heart rate, so increase in stroke volume causes increase in cardiac output, and blood pressure is equal to cardiac output on systemic vascular resistance. So with increase in cardiac output, blood pressure increase. Also from formula we see why arterioles vasoconstriction is so important, because it causes increase in systemic vascular resistance that directly increase blood pressure. Also nucleus tractus solitarius stimulate cardiac accelerator center, that cause increase in heart rate by stimulation of sinoatrial node. Increase in heart rate cause increase in cardiac output, and increase in cardiac output cause increase in blood pressure. Also cardiac accelerator center cause increase in cardiac contractility, that increase stroke volume, and increase in stroke volume cause increase in cardiac output, and again, increase in cardiac output cause increase in blood pressure. And if with low blood pressure, vasoconstrictor and cardiac accelerator centers are stimulated, cardiac decelerator center is inhibited. This inhibition prevents decrease in heart rate. So by these mechanisms, baroreceptors keep blood pressure stable. But if, for example, blood pressure increased, in these circumstances, nucleus tractus solitarius decreases the activity of vasoconstrictor and cardiac accelerator centers and stimulate cardiac decelerator center. That decreases heart rate, thereby it decreases cardiac output and cause decrease in blood pressure. So in case of increased blood pressure, nucleus tractus solitarius decrease sympathetic nervous system activity and increase parasympathetic nervous system activity. This provides decrease in blood pressure. Also, there are two important concepts for examination purposes. The first concept is that sympathetic nervous system fibers are connected to spinal cord. To be more precise, they are connected to preganglionic sympathetic neurons in intermedial lateral column of the spinal cord between T1 and L3 spinal cord regions. So sectioning of the spinal cord above T1 will result in severe fall in blood pressure, but sectioning below L3 will not decrease blood pressure. And the second concept is that every person has different baroreceptor sensitivity, and in some cases carotid sinus is so sensitive that some persons that wear a tight collar may faint after any head movement. Because in this situation there is increased pressure on carotid sinus receptors abnormally stretch. The firing rate rapidly increases, and this signal is going to brainstem and provoke over-response from brainstem coordinating centers to lower blood pressure. And with rapid decrease in blood pressure, the perfusion of the brain decreases, and this causes episodes of faintness. So it's two very popular examination questions. Okay, so to review the information. From baroreceptors, by afferent pathways, information is going to brainstem. From carotid sinus, initially in carotid sinus nerve, then in glossopharyngeal nerve, and from aortic arch and vagal nerve, information is coming to brainstem. In brainstem, information initially is coming to nucleus tractus solitarius that regulates the activity of cardiovascular centers. There are three cardiovascular centers. It's vasoconstrictor center, also called C1, cardiac accelerator and cardiac decelerator centers. Vasoconstrictor and cardiac accelerator centers provide sympathetic nervous system outflow. Cardiac decelerator center provides parasympathetic nervous system outflow. Again, the activity of these centers is regulated by nucleus tractus solitarius. By efferent pathways, signal is carried to target organs. So from vasoconstrictor center and cardiac accelerator center, efferent neurons go into spinal cord And then, as standard sympathetic nervous system innervation, preganglionic fibers are going to ganglia, and from ganglia postganglionic fibers innervate arterioles, veins, venules, and heart with heart conduction system. From cardiac decelerator center, vagal nerve provides parasympathetic nervous system outflow to cardiac conduction system. In target organs, sympathetic nervous system stimulation causes vasoconstriction in arterioles, veins, and venules. Arterial vasoconstriction increases systemic vascular resistance, and also vasoconstriction of veins cause decrease in unstressed volume. This increases systemic venous return that cause increase in stroke volume, and increase in stroke volume cause increase in cardiac output. Also, sympathetic nervous system by stimulation of sinoatrial node cause increase in heart rate, increase IV node conduction, and increase cardiac contractility. Increase in heart rate causes increase in cardiac output. Increase in cardiac contractility causes increase in stroke volume, that also causes increase in cardiac output. And recall that blood pressure is equal to cardiac output on systemic vascular resistance. So basically, all effects of sympathetic nervous system cause increase in blood pressure through cardiac output or by increase in systemic vascular resistance. The parasympathetic nervous system causes decrease in sinoatrial node activity. This causes decrease in heart rate, that causes decrease in cardiac output, and thereby it causes decrease in blood pressure. And also there is another frequently asked question related to this topic. If baroreceptors are so potent regulators of blood pressure, why there are conditions as chronic hypertension with constantly elevated blood pressure? In case of constantly elevated blood pressure, baroreceptors have issues. They don't see constantly elevated blood pressure as abnormal, so they sense it as normal pressure. This happens due to two reasons. First of all, due to a decrease in their sensitivity, this happens with age. And the second reason is that their set point that determines blood pressure is elevated or not is increased. For example, in some person with set point of 120, for example, baroreceptors rapidly react even on 130 blood pressure, because it's above their set point. But in person with chronic hypertension, baroreceptors sense 150 as normal blood pressure, because their set point is increased to 150.